you look at what animals have been eating for extended periods of time, and that will tell you what they have adapted to. And so it also, you don't need to adapt to meat. Meat is safe, meat is nutritious, it's the most bioavailable food source out there.
Hello to you all, low carbers out there. A great day to you all. I am Dr. Donna Copra. I'm a consultant neurologist. I am also a low carbohydrate health advocate. I primarily use the low carbohydrate diet, which we medical professionals also call the therapeutic carbohydrate restriction or ketogenic metabolic therapy. And I use it especially for the reversal of the metabolic syndrome, especially for my neurology patients and the spectrum, most of which include stroke patients. So today we have a very wonderful guest in the Low Carb Health Doctor podcast, and he is a very well-known carnivore diet advocate worldwide. He has his own YouTube platform with I think more than 200,000 followers already as of date, and most of you should have already known him before. He is no other than Dr. Anthony Chaffee. Dr. Chaffee, a big hello to you, and it's a great honor to have you here with us today in the Low Carb Health Doctor podcast. Welcome.
Yeah, well, thank you very much for having me. It's a pleasure.
Is it okay if I call you Anthony?
Yeah, oh yes, please do. Yeah.
Okay, so before everything else, Anthony, would you like to give us a brief background of yourself and what you've been up to for the past couple of years? I'm sure everyone listening in would be very eager to know that straight from you.
Mm-hmm. Yeah, well, I'm an American medical doctor. I currently practice in Australia. I'm a neurosurgical registrar, so I'm hoping to be a consultant neurosurgeon someday. And I also have a practice in functional medicine, really preventative medicine, where we take a prospective look at people's health and try to head things off before they become a disaster, instead of a retrospective look, looking at patients when they already have a disaster and we're trying to pick up the pieces, which a lot of medicine is. I've also spent about 25 years studying diet and nutrition, how that affects health and chronic disease, as well as how it affects athletic performance in my own life and the performance of my friends and colleagues and patients. So I've found that that's one of the strongest tools that I have to affect people's health, certainly from a prospective point of view, but also a retrospective point of view. People that already have diseases, they already have autoimmunity, they already have diabetes, they already have metabolic issues, they already have hormonal disruption, people with very low testosterone, children, teenagers, adults, and elderly adults, they can all be affected by their diet. Women, obviously very important what their hormonal health is. This affects their period, this affects their fertility, this affects when they go into menopause. And I've seen dramatic recoveries, such as women in their 50s who haven't had their period since their 40s, and then they change their diet, they change their lifestyle, and all of a sudden their hormones are working again and they come out of menopause, which may be kind of scary to a 55-year-old lady who does not want to get pregnant at 55, but it's just a sign of improved health, massively improved health, and then improving their hormones as well. So it's one of the most powerful tools that I've seen that we can use as doctors. And it goes back to attributed to Hippocrates of let food be thy medicine and medicine thy food. And another thing that was attributed to him, which was before you set out to cure somebody, ask them first if they're willing to give up the thing that's making them sick. And so I think all of those two principles and the principles of optimizing people's nutrition go hand in hand with optimizing people's health and healing them as a doctor. And that's what I've set out to do. And that's what I've set up my YouTube channel for, my YouTube channel and podcast, where I just try to just bring these things forward that I've learned over the years and try to help people with so that they can affect their own life and, not try to hide this anywhere. I like this to be open. We're like platforms like this where anyone can access them and see them, and they can take charge of their own life, and not need us as doctors for retrospective medicine, but only when there's something wrong. There's an accident. There's an emergency. Doctors are wonderful for that, and we have wonderful interventions and medicines for that, and that's very important. But I want to get back to that, but that's the majority of medicine that we're doing, instead of the vast minority. We treat about 90% plus of our cases in medicine these days are metabolic issues, chronic disease issues that don't necessarily need to exist. We address these things with diet and lifestyle interventions, and those go away, and then we just have the emergencies and catastrophes to deal with, which I think is really what medicine is about. And hopefully we'll get there in my lifetime.
It's nice to hear all of that from you, Anthony, all about you and your background. Okay, so in actual, what's really your backstory in your carbohydrate, your not low carbohydrate, specifically carnivore diet advocacy? Have you been carnivore for so long already? How did you get into this carnivore space, and what are your motivations and inspirations to really keep it as a lifestyle, so much that you are also advocating for the carnivore diet on a worldwide scale?
Well, yeah, so I only eat meat. I've only eaten meat for 6 full years now, and then in my early 20s I did it for 5 full years. So it started about 24 years ago. I'm 44 now, unfortunately, and I started this about when I was 20. And so that was because I was taking a class in cancer biology. I had already taken biology and botany. I already knew about plant toxins and how they were, almost all of them were inedible and could kill you, and all that good stuff. And then you go home and you find out, and then you get told, eat your vegetables, eat your salad, and you just don't connect the two. And so, and also that humans are apex predators, top of the food chain. Apex predators by definition are carnivores, and yet we're being told we have to eat vegetables and don't eat much meat, even though that's our biological design. So we get inundated with a lot of strange information, but I luckily had a very in tune professor, and who had a very different point of view. He was a professor of cancer biology at the University of Washington in Seattle, and he started again going over the fact that plants have toxins. Okay, well, this is something that we know, but now he started talking about spinach and broccoli and cabbage and apples, and that was a bit of a shock because, of course, these same biological principles apply to all plants. It's not just certain plants are toxic. All plants are toxic, or else they would go extinct if they can't defend themselves more often than not. And so he was putting this in the context of cancer. And obviously it's a cancer biology class. So we're looking at this from an aspect of carcinogens. So many of these have been shown to be carcinogenic, and going back decades, we had research showing that these were carcinogenic in lab tests and animal models. And he was telling us that actually the ones in vegetables were far more carcinogenic than, say, the pesticides we spray on those vegetables. Not to say that pesticides are not bad, because they are, but that the pesticides, the naturally occurring pesticides and insecticides in the plants themselves, are actually worse. And this was shown by Professor Bruce Ames at UC Berkeley. Now, his argument was, hey, why are we going to ban pesticides when the pesticides in the plants that they naturally make are worse? They're 10,000 times more abundant by weight, and they're 500 times more likely to cause cancer than the pesticides we spray on them industrially. And so his argument was, well, since everyone knows that vegetables are good for you, that fruits and vegetables are good for you, then obviously these pesticides can't be all that bad for you. But I think that's assuming a fact that's not in evidence. He's assuming that these plants and vegetables are good for you because that's what everyone said, and that's just been repeated for decades. But is that actually true? Well, a lot of these pesticides are quite harmful, and the plants are worse. So that puts that in perspective for people. And so we were looking at this, and he just went through, and it was just telling us the amount of carcinogens, the number of carcinogens that were in all these different vegetables. So we were given a handout sheet with every single produce item, fruit and vegetable, root, tuber that you've ever eaten or ever seen on display for sale, and they had a number next to them that corresponded to the number of identified carcinogens in them that had been so far identified. And there were dozens in absolutely everything. In Brussels sprouts, there were 136. Mushrooms had over 100. But every other produce item, spinach and broccoli and kale and cabbage and apples and mangoes, grapes, think about it this way. Avocados and grapes will kill cats. They're toxic to cats. They get very sick. If they have enough of it, they can die. So that means there's toxins in them. We can handle them a bit better than a cat. But we are still contending with those toxins. We do have to detoxify them. So in any case, some of these things were known to be carcinogenic. And we were very blown away by this. We were very taken aback. And I remember everyone just looking around wildly, going, how can this possibly be? Someone has to be in on the joke. This has to be some sort of gag that he's playing on us. But there wasn't anyone in on the joke. There wasn't anyone laughing. And we came to the realization that he wasn't joking. And I remember thinking in my head, I was like, okay, but vegetables are still good for you though, right? And he just looked at us and he just calmly said that he didn't eat salads and he didn't eat vegetables and that he wouldn't let his kids eat vegetables. And then in his words, plants are trying to kill you. I said, okay, forget plants. And so I didn't do this from a carnivore perspective. I didn't say, well, ancestrally, biologically, this is how we're designed. This is our makeup. This is our physiology. This is our biology. I looked at it from just plants are toxic. I'm not going to eat any plants. And so I just went to the store and I'm just walking around dazed and lost and couldn't find it. It was like everything had plants in it. Every ingredient, there's so many ingredients or so many foods have ingredients that are plants. And that's by design. It's very cheap to produce. There's a very high markup. There's a very high profit margin. And so this is what a lot of the processed food companies have moved into, is because it's very, very profitable for them. And there are other motivations as well, but that's certainly a big one. And so I came across eggs and I came across meat and I said, okay, well, these don't come from plants, so I'm just going to eat those. And so I did that for 5 years and I've never been healthier in my life until right now. And I slipped off of it because I didn't realize how significant what I was doing was, but that was a hard line. I remember thinking when I was 25, I was playing rugby professionally over in England. And I remember thinking I was sitting there and I had just started slipping off. I just started adding little bits of things in, just a bit of crumbs on the chicken. And that's it. Everything else is just meat. And that was enough to really hold me back. And I remember thinking to myself, why don't I feel as just superhuman amazing as I normally do? Am I not working out as hard? Am I not pushing myself? Am I just too old now? I'm 25, so I'm just over the hill. I'm just dying now. And I figured that's what it was. It was just, people say that when you get into your mid to late 20s, everything just starts slowing down. I was like, okay, well, that sucks. I didn't expect it to hit that hard. But that's what actually happened. I started slipping off of things. And once I started adding some things in, I convinced myself that it was okay to add other things in because, as people try to argue now, like, okay, well, yes, there's poisons in there, but dose makes the poison. And the tacit continuation of that is, well, dose makes the poison, therefore eat as much as you want. It's not going to be poison. It's like, well, no, if dose makes the poison, then you need to know what that dose is. Like any doctor, this is the toxic dose. You don't exceed this limit on this medication. Below this limit, you're probably not going to do anything. So you have this therapeutic window. So if you do have that, if you do have a toxic level, you need to know what that is. In blood sugar terms, you have 4 grams in your body, in your bloodstream at any given time. And that's good. That's 1 level teaspoon. That's barely anything. 1 extra gram is a toxic dose to your body. And your body treats it as a toxin by trying to detoxify it, by raising your insulin and to get that below 4 grams. So that's the line for glucose. It's 4 grams. Below that, it's okay, it's safe, it's helpful, it's hormetic. Above that, it's toxic. And this is what kills diabetics and causes all sorts of horrible diseases. And so if you don't know what that line is, you can't just throw that out there. But I sort of was convinced myself with that as well. And so I justified adding some things in. And it wasn't until about 6 years ago that I just came across information that said, no, humans actually are carnivores. That's just the kind of animal that we are. And that's what I was doing for 5 years when I've never felt better and I've never been able to get back to that level of health and fitness. And so I said, right, I knew it. I knew plants were trying to kill me, get rid of these stupid things. And I just started eating a lot more meat, and I completely cut out all plants and vegetation. Within 2 weeks, I was a completely new man. I'd lost 23 pounds in just about 2 weeks, just under 2 weeks. And my physical health was so much better. My athletic performance was so much better, to the extent that at 38 years old, I decided to go back and start playing professional rugby again in Seattle. And I felt amazing. And I was able to keep up with these people in mid-season where they're in great shape. I hadn't played a full season in 3 years, and yet I felt amazing. And so I was able to just get back out there and keep going. So it made a huge difference for me. And because I saw that, because I had sort of this background that I did, I started asking questions. I started looking at the literature. And because I was taking a bit of time off from work, I was spending anywhere from 8 to 10 hours a day for months, just reading studies and looking at the literature and asking questions, and then trying to find evidence to answer those questions with in the literature. And so that's what I've been doing. And then I've been trying to incorporate that into my practice, just as a doctor, as I'm sure you've seen when you come across this and you see the effect that it has on your patients. It's not something you can unsee. And once you see how powerful that is, that's something that you have to keep using for your patients, because it is such a huge effect. And so when I started looking at medicine from the perspective of humans biologically are carnivores, that's the kind of animal we are, but we're not living as such. We're not eating a carnivore diet. And if you feed another carnivore plants and other things that they're not designed to eat, they will get very sick. If you feed a bunch of kelp to dolphins, they're going to die. They're not going to do well. Lions don't eat grass, and that's a good reason for that, because it's not good for them. So if you feed these animals predominantly kibble, if you gave dogs and cats a bunch of grain and plant-based kibble, they get the same diseases we get. They get obesity, they get organ dysfunction, they get diabetes, they get cancer, they get autoimmunities. There's feline lupus and things like that. So those don't exist if they are not fed this plant-based diet. When you are not designed to eat certain things. And if you eat those certain things, you're going to get sick. And a zookeeper can tell you that if you feed animals human diseases or human food, they will get human diseases, right? That means that the food is causing the disease. There's a cause and effect relationship there. You add in the processed plant foods that we eat, or even just plant foods that we eat, just grains and things like that, we get sick, they get sick. You take that food away, it goes away. There's a cause and effect relationship. And that's certainly what I've seen in my practice as well. You just remove these things, you get people eating the way they're naturally supposed to eat. And many, many, many of these chronic diseases get significantly better. And some just go away entirely.
Wow, that's practically a whole load of information you got there for all of us. And when you mentioned earlier that as doctors, we just cannot unsee something that we've already seen as very significant information, especially when it comes to the dietary guidelines that has been shown to us through the years. So when you were saying earlier that plants are toxic, well, let's say vegans would probably be much against that. And then when you were saying all those things, so are you coming from an evolutionary anthropology perspective when you're saying that there is a species specific diet for each animal, including us human beings?
Yeah. So, yeah, exactly. So when you look at biology and you look at evolution, biology is one of the immutable laws of biology is that of adaptation. When an animal species or a group has stressors to their environment, they either adapt to those stressors or they die out. They're not fit. They're not, the survival of the fittest. They're not able to deal with the environmental changes or the environment that they are in better than other things. Other things are better suited. They thrive better. They fight them out for resources and things like that. So you look at what animals have been eating for extended periods of time, and that will tell you what they have adapted to. And so it also, you don't need to adapt to meat. Meat is safe. Meat is nutritious. It's the most bioavailable food source out there. So it's actually quite difficult to change plant tissue into animal tissue, which is entirely different forms of life. But it's very easy to turn animal tissue into animal tissue and get those nutrients. Plants lock up their nutrients in ways with chemical bonds that are difficult to break, and we don't have the capability to break many of them. This is the idea of bioavailability. Meat is completely bioavailable. It doesn't need to lock up its nutrients. Plants have defense chemicals. They're stationary. They can't run away or fight back like an animal can. And so they have to have other defenses, innate defenses, that they can use to deter animals from eating them, because they're under constant assault by things trying to eat. Everything's under constant assault in nature. Everything is kill or be killed. That's always the way of it. And so that goes for plants as well as animals. So plants is an objective fact. Plants make about, the entire kingdom makes about 1 million different defense chemicals. And so this is to stop other animals, insects, fungus from eating them and preying on them. And so, you can get a conglomeration of facts and evidence all point to one thing. You should eat what your species has been eating for the longest period of time. 2, meat doesn't have anything harmful in it because it doesn't need to, because there are different defenses that animals have. Now, some animals use venoms and poisons and things like that. Those are generally the smaller animals, but the meat itself generally isn't toxic. Maybe organs or something like that will have some things in there that aren't great for you, like the liver of a puffer fish, the fugu fish. Liver of a polar bear has a toxic level of vitamin A, but that's not a defense chemical. That just has a ton of vitamin A in it, and that will overwhelm your system. But the meat itself, in general, is fine. Plants aren't. So if you haven't evolved to eat a specific plant, that plant is harmful to you. This is something we teach in junior high biology. So I certainly was, which is plants and animals are in an evolutionary arms race. Plants becoming more and more toxic, so less and less animals can eat them, so they can survive and thrive. And then animals becoming more and more adapted to specific poisons in specific plants, so they can eat that plant and survive and thrive. And this is why, of the 390,000 plants in the world, more being discovered all the time, koalas eat 1, pandas eat 1. The rest of the animals that eat these plants, they eat specific plants. If you mix those plants around, they will all get sick or die. We can eat spinach, but we can't eat eucalyptus. Almost nothing can eat eucalyptus except a koala. But a koala can't eat anything else. They just eat the eucalyptus. We would do bad on eucalyptus. They would do bad on spinach. So that's the idea. So evolutionarily, anthropologically, paleoanthropologically, we have all the best evidence shows that humans have been apex predators for at least 2 million years, and were largely eating meat before that in a sort of gradient fashion. So about 6 to 8 million years ago, our ancestors were herbivores, and then they started eating more and more meat as you go. And then about 2.5 million years ago, when the ice shelf started coming down in the ice ages, that's when a certain population of our ancestors, the Homo habilis, they transitioned into apex predators. And they were the ones that were able to survive and thrive, and that's who we were descended from. And then we became the most dominant species on Earth during the ice ages, and likely because of the ice ages, because that forced them into full carnivory. And we became very, very, very adapted to that. And we had to use our intelligence because, we don't have big claws and teeth like a lion. Like, okay, well, you have plenty of fish that don't have teeth at all, and they only eat other fish. You have birds that have beaks, and they either eat plants or they eat meat. And so, and you have gorillas that have big fangs, and they only eat plants. So, just having fangs doesn't mean anything. We're primates. We have primate teeth. We have very similar shaped teeth to other primates, but we have carnivorous adaptions, which is where they're smaller. And we have smaller muscles of mastication because our teeth were getting smaller and smaller and smaller, and jaws were getting smaller and smaller and smaller because we were chewing on softer food. We're eating more meat. We're not chewing on sticks all day like a gorilla. And so a gorilla's head, most of that head is actually the muscles of mastication, the temporalis muscles. And they're very thick. They have this big ridge of bone that goes down the middle, small little brain in there, and then big, muscle over that. So we have these carnivorous adaptations. Our physiology, we look at that, they're carnivorous. Our gut is much, much, much shorter than other primates that eat an herbivorous diet. We have a comparatively long small intestine and a comparatively short large intestine. And that's because we're absorbing the majority of our food and nutrients in the small intestine. It doesn't go to the colon and the cecum like it does in a gorilla or a chimpanzee, where that's where the fiber gets to and breaks down and gets fermented by the bacteria there and turned into actually saturated fat and protein. That's what they turn the fiber into. They don't get glucose from it. We don't get glucose from it. The bacteria eat it, and they produce as a byproduct saturated fats, short chain fatty acids, and then the bacteria die off and the animal absorbs that as protein. So they eat fiber, but they absorb fat and protein. That's what animals need. That's what we need, and we can't get that from plants. We have gorillas have a cecum. It's a very elongated appendix. Our appendix is about the size of a pinky finger. So that is a vestigial use. We used to be very elongated. Primates are called hind gut digesters. And so when that's very elongated, that's where fiber packs into and it breaks down into fatty acids and protein. But we've lost that ability because we have not used our cecum in that capacity for millions and millions and millions and millions of years. So there are a number of different reasons. We have pH of our stomach acid is between 1.5 and 2. And that's very, very low. That's in the range that you'd see carnivores, certainly, but also vultures and carrion animals, because we likely had that in our past where we had to sort of scavenge off of what other people killed or what other animals killed. And then eventually we became apex predators and were able to go after the whole animal. But also we didn't have refrigeration up until, a century ago. And so, they had some stuff. They had like ice blocks in the cellar and all that sort of stuff to keep things cool, but no like electric refrigeration until very recently. You have to contend with a high bacterial load because bacteria is going to grow on the meat. So there are many, many, many ways of coming at this to show that humans biologically, biochemically, anthropologically, paleoanthropologically, evolutionarily are carnivores. You look at the simple difference between pre-agricultural humans and post-agricultural humans. It's a dramatic difference. Their height dropped by 4 or 5 inches overnight. This didn't take hundreds of years. It didn't take thousands of years. It was overnight. And their jaws became smaller. Their teeth became crowded. They had poor dentition. They had poor wound healing, shorter femurs, signs of infection like tuberculosis up and down their spine. The brain size, the adult male brain size dropped by 11%. Nearly immediately after agriculture, and it's persisted until today. Adult female brain capacity actually come down by 17% immediately, and has persisted until today. And we see this in real time. We've seen this in different indigenous populations that have had more recent exposure to Western expansion, such as the Native Australians and the Native Americans, certainly like those in the Plains Indians in North America, who were shown to be extremely tall at the time. In the 1800s, when they were only eating bison, they were shown to be the tallest population of people on Earth at the time. And they are not anymore. They did not persist in that demographic since they lost their food supply. So the Plains Indians are just eating bison and high fat, meat-based diet. Meat-only diet, really. Generally, they did not eat anything else. Some people say, well, they put berries in their pemmican. Actually, they only put berries in their pemmican to sell to Westerners who wanted it a bit sweeter. But what they ate themselves was just the meat and fat. And so there are many, many different ways of looking at this. But you can look at the recent addition of the Native Americans and Native Australians to an agrarian lifestyle. And you see the health ramifications of them. They have far higher chronic disease rates, obesity rates, diabetes rates, cancer rates, and all the rest than European Americans or European Australians. It's far, far higher disease prevalence in those communities. In fact, I had a patient that just last week who works with the Native Australian populations. And that's part of the culture. They say when you're in the cities and you're just sort of eating and doing whatever that people do in the cities, and you get sicker and fatter and less healthy, what you do is you don't go to the hospital. You don't go to Western doctors. What you do is you go back out in the bush. You live with your family out in the middle of nowhere. You go back to living a traditional life, eating a traditional way, just hunting and eating meat. And after a few months, they all get better, and then come back to the cities and get sick again. But that's understood. And so we are seeing a direct cause and effect relationship between eating the wrong things and having serious ramifications from both our development and our health as adults.
So those things you mentioned about the Aborigines there in Australia and the American continent, I think that also applies to what recently happened to the Polynesians. I heard that from Dr. Gary Fetke about the change in the diet of the South Pacific Islanders, and now they're among the top notchers in terms of the incidence of obesity and diabetes worldwide. When you're mentioning those things about the toxic properties of plants, I suppose that will be on top of and separate also from the Warburg effect, right? In relation to sugar and cancer, you were mentioning earlier about cancer in plants. So that's on top of the Warburg effect, as Professor Thomas Seyfried has been advocating through the years.
Yeah, right. Definitely. Yeah. Well, the thing is that there are toxins in plants that are directly toxic or indirectly harmful in that they can, things, anti-nutrients, phytic acid, oxalates, tannins. These will bind to different nutrients and proteins to not allow you to absorb them. They can get in your bloodstream and actually strip out these nutrients out of your bloodstream. Or things that block your body from being able to break them down, like protease inhibitors that block protease, which is an enzyme coming from our pancreas that helps break down large proteins into amino acids so we can absorb them. And those things are just directly toxic. Like North American water hemlock will block the GABA receptors in the brain, so the brain cannot calm down the excitatory signals, and people just go into intractable seizures, and they die within minutes because you cannot stop the seizures, and they're very severe. And so there are things that are directly harmful, directly toxic, indirectly harmful in a number of ways. But there are others that aren't necessarily designed to be, and the things that disrupt your hormones as well. So these things are designed by the plants to try and deter animals from eating them. It's a direct defense. Even latex, we use latex gloves in medicine all the time. But that was a defense mechanism from plants. It's actually a very sticky sap that when animals start eating those plants, they start releasing latex and actually glues their mouth shut and stops them from being able to eat the plant. It's a pretty elegant way to stop something from eating you.
Amazing.
If you just glue its mouth shut, which I think is pretty clever. The problem is for the animal, it usually kills them because they can't get their mouth unstuck. They can't get their teeth unstuck. So the plant has no problem with you dying if it gets to live, just like a bison or a buffalo in the wild doesn't want to eat you, but if it feels you're a threat, it will happily kill you in order to preserve itself or its children's health. So there are direct defenses that plants have, but there are other things that can also cause harm, which are not necessarily meant as a defense, like glucose. We're not meant to eat glucose. We're meant to make glucose. We're meant to eat protein and fat, and we're meant to make glucose and blood sugar, glycogen, ketones, and things like that. When you eat outside sugar or carbohydrates, that raises your blood sugar above that 4 grams that we talked about. And that's toxic to the body. So your body responds to it as a toxicity by trying to detoxify it. Otherwise, you get people with diabetes and you creep up to 4.5, 5 grams of blood or of blood glucose. And this is what starts killing people. Those glucose molecules are physically fusing to other molecules. They permanently damage them. They cause AGEs, advanced glycation end products. And these are very damaging to your body. People end up getting amputations. Their kidney function drops off, and they eventually die from the complications of diabetes. But that's not a direct defense mechanism from the plant. But what it is it's a very good illustration of what can go wrong in our body and our health when we don't eat what we're designed to eat. And as you say, this is really important in the aspects of cancer, because what Professor Seyfried has shown, building on the work of Dr. Otto Warburg, for whom the Warburg effect is named, he's a Nobel Prize winner in physiology and medicine. They have shown that cancer is really not a genetic disorder. It's a metabolic mitochondrial disorder. So you get dysfunction, damaged mitochondria. The cell can't make energy properly with the mitochondria, so it goes back to its former older form before cells had mitochondria in them. They had to make energy a different way by substrate level fermentation, and so that's what our cells go back to when the mitochondria are so damaged that they can't make energy anymore. And so this is very harmful. This kicks off a lot of free radicals, causes a lot of damage, causes DNA damage, and can cause a lot of mutations as well. But the mitochondria are the policemen for the cell to stop cell division and replication. And so you have the stop force mechanism blown away. So now you have unregulated cell growth because the mitochondria can't stop the cells from growing. So that's what cancer is. It's unregulated cell growth. And it also is true that the mitochondria are basically the executioners when the cell goes through apoptosis, programmed cell death. So it says, okay, things are too damaged, things are too messed up. We need to just shut this cell down and kill it from the inside. Well, it's the mitochondria that do that. And so if the mitochondria are damaged, now they can't go through apoptosis and they can't stop the unregulated cell growth. So you become more and more problematic. Why does this matter for cancer prevention in the sense of with carbohydrates? Well, the reason being is that high insulin, when your body is trying to detoxify your blood sugar down below 4 grams, it has to go about this by using insulin. Insulin is the fat storage hormone. This gets blood sugar down. That's the only way really your body can do that, is by raising insulin. Insulin is very disruptive in your body. It disrupts all your other hormones. It entirely rearranges your metabolic structure. It just puts you into an entirely different physiological pathway. And it also blocks a lot of physiological processes such as autophagy, which is the turnover of older cells that aren't really working as well. But also autophagy, part of that is actually replacing out the individual organelles within the cell, such as the mitochondria. That's for mitochondria, it's called mitophagy. And so you're replacing out the older damaged mitochondria, replacing them with new, faster, better ones, and you're increasing the number of them. And it's really important to have the right amount of mitochondria that work properly, because they don't just sit there making energy. They physically move on the internal cytoskeleton structure of the cells, and they go to this organelle, to this cell membrane, to this little transporter, and they give them energy to turn those functions on so that they can do their job. And so they're the ones actually running the ship. It's almost like a little factory where they're going around, little workers going around using the equipment to make the factory run and productive. So when you go into a ketogenic diet, like a carnivore diet, and this is why I think ketogenic diets work, is because they're getting closer to our biologically appropriate diet, which is a carnivore diet, which is a ketogenic diet. You get your insulin levels down to normal levels because you need insulin. Type 1 diabetics, they don't have any insulin and they waste away to nothing. They can't store fat and then they die. So you have to have insulin. It's very important. But you get too much. They say someone has an insulinoma, they have a tumor that produces a lot of insulin. They get extraordinarily obese very, very quickly, and they get very sick metabolically. So you want to be in the right range, right? So again, go back to toxic levels and all that sort of stuff. There is a range that you want your insulin. When that is in a normal range, your body can go through autophagy, can go through mitophagy. Some people do this with fasting, and that works. But what that does is it gets your insulin down to a normal level, and then all these processes turn back on. So it's not just fasting. It's specifically avoiding carbohydrates and things that will raise your insulin. That's the important feature there. And so when you do that, it has been shown in various studies that after a few months on a ketogenic diet, that you will have 4 times the number of mitochondria, and they'll be 4 times as effective. And so that's very protective against cancer and most metabolic diseases. And as Warburg showed, and how Professor Seyfried has reiterated and shown again, is that if you have healthy mitochondria, you cannot get cancer. And so being on a ketogenic diet, carnivore diet, this is very beneficial for your mitochondria. So, and that is very beneficial in the prevention of cancer. Also, these plant toxins that can be carcinogenic, they damage the mitochondria. Different genetic disorders, Tay-Sachs disease, these sorts of things they damage the mitochondria and the normal functioning of the mitochondria, radiation, other sorts of environmental toxins that can cause cancer. They all damage the mitochondria and other things as well. They do other things. It's not just mitochondrial damage, but they do damage the mitochondria. And so the Warburg effect comes into play when someone has cancer and these mitochondria don't work. And so they're not making energy very efficiently. And so they need more glucose. They need more substrate in order to make the same amount of energy. So, and also they have a much higher metabolic demand because they're just constantly replicating and dividing. So the Warburg effect is that these cancer cells require about 400 times the amount of glucose that normal cells do. And so this is why, and we use this to our advantage in medicine by using positron emissions, sort of CT, sort of PET scan, where we inject people with radio-labeled glucose, and then we do a CT and we see where it goes. And you see those little bright spots. And we say, oh, here, bright spot here, here, and here. Those are likely metastases into the lungs, right? What does that mean? That means that you've given glucose and it just sucks it right up because it needs it for this high metabolic demand. Every time you eat sugar, it does that. Every time you eat bread, just imagine that PET scan with all those areas lighting up, because that's what it's doing. And so what you want to do is you want to limit the amount of glucose that you take, and you're going to make it. You're going to make some yourself, but that level is going to be low, and the last thing you want to do is spike that up. If you keep those levels low and you don't take any extra in, then the energy supply and food supply to those cancer cells are going to be extremely curtailed. And that it has been shown clinically and preclinically to be very, very beneficial in cancer survival and cancer treatments, and with a number of different cancer forms of cancer. In our field, GBMs, so glioblastoma, brain cancers. This has been fairly well studied. There's about 24 human trials and studies that have been done. Smaller numbers, usually anywhere from 20 to 30 patients, but case series as well, like 30 patients or so. From Cedars-Sinai, maybe it's not quite 30, maybe it's around 20. Showing that people using this ketogenic metabolic therapy generally as like a fourth line treatment. They've given chemo and radiation. They've had debulkings. They've had further debulkings. They've had further chemo radiation. They've been put on Avastin, and they've got another recurrence. And now you can't operate because someone's been given Avastin. They really won't survive the surgery. And so I say, okay, well, you could try not eating bread. And so,
expounding on the GBM, glioblastoma multiforme that you were mentioning earlier, I'm sure our audience would appreciate a lot if they understand that that glioblastoma multiforme is one of the worst brain tumor that one could ever have, and yet it really significantly improved with ketogenic metabolic therapy. That's it's almost like a miracle,
It is. Yeah. Well, as you know, but the listeners may not know, without treatment for a GBM, the average life expectancy from point of diagnosis without treatment is 3 months. And then if it's in an area of the brain that you can't operate on, you can't debulk, you do chemo and radiation, depending on the molecular, the specific sort of moleculars on the GBM, it could be 9 months. You could increase that by 6 months with both chemo and radiation. And depending on how they respond to it, with surgery getting over 95% debulking and chemo and radiation, you may push that up to 15 months, 18 months. Some areas are sort of getting, up to the 2-year mark. Okay. So that's a lot better than 3 months. But now we have people that are looking at this and saying, hey, look, I have the most aggressive kind of GBM. Chemo and radiation really don't work for that. It's not something that they can get most of it out because it's in the motor strip or it's in something else that's important, and we can't operate on that area. And so they really don't have many options. And so they say, okay, well, instead of doing something that statistically I know won't work, they go and look for other solutions. And some of these people have found ketogenic metabolic therapy, and they have tried this. and they're still alive 10 years later. So one gentleman I was thinking of was a young man named Andrew Scarborough, who I've had on my podcast. He was diagnosed with the most aggressive form of GBM 10 years ago. And he decided that the chemo radiation wasn't the way to go. He went on a keto carnivore diet, and he not only suppressed the growth of his tumor, he had a bit of a debulking, but most of it was in the motor strip, and they couldn't operate on it. And so he not only has suppressed that from coming back, I don't think to my knowledge, he hasn't had any further debulkings. It was just that first debulking. He started chemo radiation, he got the moleculars back and said, nope, this is a waste of time. And he stopped that. And he's just been doing diet and lifestyle since then. And it's probably over 10 years now at this point. And he's gotten an advanced degree. He's doing his own studies in humans on ketogenic metabolic therapy and GBM at Charing Cross Hospital in the UK. I believe he's a medical student now as well himself. So, he's been very, very, very functional past the point of no return. And there's a number of other examples of this with GBM, which is extremely, extremely aggressive. Professor Seifried has done a lot of work with GBM in both humans and animal models, and he's shown really, really good evidence in animal models that this is a very viable treatment, and that adding in things that disrupt glutamine metabolism is really important as well, because cancers can also run on glutamine as well as glucose. They cannot run on ketones. That's the whole key. So if you're in a ketogenic diet, your blood sugar is staying low, your ketones stay high, your normal cells can all run on ketones, and they'll have enough glucose too. But the cancer cells can't run on ketones. But they can also run on glutamine. We make glutamine. It's an amino acid that we make. It's also in both plants and animal protein. So it's not really something you can avoid unless you just fast. And some cancers use more glutamine than glucose, and GBM is one of them. They get about 75% of their energy from glutamine. But even just doing keto carnivore sort of diets are keeping Andrew and these other people. I've had 3 people on my channel now with GBMs that have all sort of hit the 10-year mark with just initial treatment and then nothing after that, just diet and lifestyle. And so, and that's without addressing the glutamine side of things. So if you address the glutamine side of things, it's even better. So with the ketogenic side, it at least sort of keeps it down where it's not growing crazy aggressively and maybe just stays in its box. But with the glutamine, they just die. So in animal models anyway. So Seifried did a study with mice where they took they transplanted GBM equivalents into mice brains, and then they put them into 4 different groups. So one was just given the normal chow that they give the rats, mice, and then another one was given calorie restricted ketogenic diet. Another one was given a medication called DON, which I forget the whole chemical name, but it's DON is the acronym, but that's for a chemical name, scientific chemical name for this molecule, and that disrupts glutamine metabolism. And then another group that was given both the ketogenic diet, and DON. So first group, as you would expect, just given normal chow, they died pretty early on. Then the ketogenic group actually lived twice as long. But then the DON group that disrupted glutamine lived another week on top of that. And so, that's quite significant because, and it makes sense, if this is true, that this is the mechanisms going on, that these are the energy dynamics, and that glutamine is more important than glucose for this particular cancer, that would make sense. So it all stacks up. And then the group that was given both the ketogenic diet and DON, they didn't die at all. All of them survived. 100% of them survived. And giving scans when they're alive, they were just shrinking. Some of them had completely disappeared on imaging. They, at the end of the study, sacrificed the animals and then looked at the brain under the microscope, and most of them were just dead cells. They were completely dead. All these tumor cells had just died off because you've cut off both of their main energy sources, and so then they can't live and they just die. They're trying to divide, and they just blow themselves out, and they just burn themselves out, and they all die. And so that that is very, very, very promising for treatment in humans. We have treatments for people in for glutamine disruption, but they're not licensed for GBMs at the moment. Like Dawn, I believe it was originally used for leukemias, so you could probably use it for that, and probably why it's so effective is disrupting their energy dynamics. You go on a ketogenic diet, and Dawn for that type of leukemia probably would have a massively increased success rate. But hopefully we'll be able to get something licensed or at least trialed for Dawn and these other sort of disruptors. There are other ones that are sort of being trialed, but this is something that I think it's off patent, and so they don't want to use that one. They want to use something new that they can patent and make a lot of money on. So obviously, people just aren't putting the money in to see if an off patent drug is any good for this. They want a patentable drug that does that. But there are other things as well. There are other drugs that disrupt these, and that's something that Professor Seyfried has shown. I mean, even things like antiparasitics like fenbendazole or mebendazole, these have been shown to disrupt glutamine as well. So there are things that can be used. It's important to start doing these trials in humans and showing that this can help people, and then getting them licensed as well. But it's a very, very interesting demonstration of the biology and physiology, and also just a further compounding of the evidence of how important it is to eat a natural, human appropriate, species specific diet, because you don't get cancer, and you can even further than that, there's studies in 2019 and 2020 that showed that being on a ketogenic diet made chemo and radiation more effective. It killed more cancer cells, it sensitized the cancer cells to chemo and radiation, and it protected the native cells from chemo and radiation. So there was far better outcomes with that as well. So there's just time and time and time again, this is just showing how important, how necessary it is to eat a biologically appropriate diet, because animals that do eat biologically appropriate diet in the wild, including humans, like the Inuit, like the Native American, like other populations, they have almost no rates of cancer. Zoo animals that eat their natural diet have almost no rates of cancer when they're being fed other things. They're being fed kibble and nonsense. Then they get cancer, just like dogs and cats and just like humans. Harvard professor Vilhjalmur Stefansson, he was a polar explorer and ethnologist, and he lived with the Inuit up in northern Canada and discovered huge tracts of northern Canada. And he lived out there for 12 years, off and on, but he learned their language, learned their culture, and learned their ways of eating. And he ate just meat the whole time. He's never felt healthier. He's always the healthiest when he's doing that. Started studying it, wrote a book called The Fat of the Land, which is very interesting. And he also wrote other books, one of which was called Is Cancer a Disease of Civilization? Because as he pointed out, these indigenous populations that are still eating a more traditional diet, living in a traditional way, they really don't get cancer. And the cancer rates of the Inuit throughout the 20th century were very low, and just sort of decade by decade, just slowly creeping up. Well, why is that? It's not their genetics, it's their environment. They're starting to eat more Western food. They're starting to get more Western diseases. When they only eat the meat-based diet, the meat-only diet, they don't get cancer. They don't get diabetes. They don't get heart disease. They don't get any of these other things. And it's only when they started being incorporated into Western civilizations and eating Western food and having these Western exposures that they started getting these Western diseases.
That's certainly a whole ton full of fantastic and wonderful information you shared with us there. But for the past couple of years that I have been advocating a low carbohydrate diet to my patients, specifically my stroke patients, I think talking about GBM, I think the longest patient that I have seen, a patient with GBM that has survived the longest, I think in my own experience, something like 6 to 8 months. So what you mentioned earlier about that patient surviving even more than 10 years is really almost unimaginable. It's hard to grasp such realities. with this ketogenic and carnivore diet. And ever since I've been into this, I've come across a lot of questions and doubts from my patients. So from your end, what would you say are the most common misconceptions and myths, perhaps, of the carnivore lifestyle that are still prevailing up to today? And perhaps as a corollary to that, how do you personally respond to people, especially those saying that since the carnivore diet is really all about eating meat, and therefore it will elevate cholesterol levels and also increase the risks for atherosclerotic heart disease, including what lay people would call heart attacks. What's your idea with regards to that? How do you respond?
Yeah, so there's a number of very commonly raised concerns. First and foremost being, you're going to eat all this meat and fat and you're going to get heart disease, you're going to get a heart attack. And that is factually incorrect. That is what is being taught. That's what is being pushed out there. But it's being pushed out there originally by the sugar companies, the Sugar Research Association, Research Foundation, now called the Sugar Association. We have documentation, their own notes about how they were paying off American doctors and professors at Harvard and elsewhere to falsify data and publish fraudulent studies to make it appear as if cholesterol caused heart disease, when it's more likely that it was sugar and processed foods, and that the increase in heart disease over the 20th century, which is a brand new disease, by the way. The first heart attack diagnosed, first myocardial infarction diagnosed on autopsy in America was in 1912. No one knew about it before that, and no one believed him that this was a new disease. Like Dr. Alzheimer's, he described Alzheimer's disease, I believe, in 1902, but it was in the early 1900s. There was nothing before that in the literature that described the same disease process of Alzheimer's dementia, called by any other name. That was a new disease, and that's why his name is on it. It's not a 5,000-year-old disease. Dr. Alzheimer's was in the 20th century, not the first century, right? So this is a new disease process. These are new disease processes. And then 10 years after the first myocardial infarction, death by myocardial infarction occurred, more had started showing up. So they said, okay, well, there's some new disease coming in. We don't know what this is from, but okay, that's interesting. 10 years later, it's the number one killer in America. So before that, there was no heart disease, no heart attacks known. There was no confirmed diagnosed deaths from myocardial infarction prior to 1912 in America. And we were eating a lot of meat. We were eating a lot of fat. In fact, the onus was put on fat because everyone knew that was very, very important. That's why it was called rich food, because the rich people could afford it, and it was sought after by everybody. And that's because it was very important. It was very healthy. So how can an ancient diet cause a new disease? We were eating more meat in the 1800s in America than we were in the early 1900s, when this became the number one killer in America. Far more. In fact, we were eating a lot in the early 1800s, and that sort of started coming down a bit. And then the trough, the base, was in 1920 to 1930. In fact, from 1912 to 1930, when it became first confirmed case down to the number one killer in America, we actually were eating less meat in 1930 than we were in 1912. So we're eating far less in the 1800s than we were in the 1930s, when this became the number one killer in America, and then just started to climb up. And then we started increasing the amount of meat that we ate as well. And so maybe you might look at that and say, oh, look, there's this correlation. We're eating more meat in the 20th century and heart disease is going up too. Okay, look the previous century and the previous century and the previous century and the previous century. There's no correlation at all. It's completely unrelated. And so, people just didn't notice it. I mean, that's just an ignorance of history. People were very, very astute. They absolutely were describing the world around them. There are medical journals going back to Hippocrates. Galen had entire libraries of his documented work and experiments and observations. I mean, Francis Bacon. I mean, all these sort of people, yes, they're just idiots. They wouldn't notice anything. These people described the circulatory system. We have Google. We look this up. Someone told us this. These people were absolutely mega geniuses that had no technology, and they had to figure out our anatomy and physiology just through physical means. I mean, you have people figuring out, how to calculate the number of atmospheric or gas atoms in a space in a room hundreds of years ago. They didn't even have calculators, right? So, I mean, these people were absolute mega geniuses, and the idea that they just wouldn't have noticed, billions of people just dropping dead of heart disease is just absurd. It's ludicrous, And so, and they're doing autopsies. You've been doing autopsies for thousands of years. The period there that the church didn't really want you doing much of any. But then in the Renaissance, they started letting people doing this. So, Da Vinci did all kinds of dissections. And I guess he was an idiot. The guy came up with helicopters 500 years ago. You don't think he'd noticed blocked arteries? I mean, come on. This is just so stupid. So there's no correlation. There's no relationship. This was a scapegoat by the sugar companies. That's documented fact. That's published in the Journal of the American Medical Association, JAMA, in 2016. Their own memos. And one of those professors was named head of the USDA. He was the one who authored and published the USDA declaration saying that cholesterol caused heart disease when it was really sugar. And this is a fraud. This is a known fraud. And so you have this entire body of teaching and thought based on this false premise and this lie that is a known lie. And so we really just have to throw this out. And there are plenty of other studies, even the Framingham study. This is very cardinal paper done in cardiology. And I was taught this in medical school, that the higher the cholesterol levels, the higher their level of cardiovascular death. Okay, fine. Correlation is not causation, but there's that. And you don't really ask questions past that as a medical student. Okay, yeah, well, everyone knows that cholesterol causes heart disease. Oh, here's a study that says, oh, okay, that's great. And you don't look into it too far. If you did look into it further, you'd find out that wasn't actually what the Framingham study showed. That was what the American Heart Association, again, on the payroll of the sugar companies, that's what they said it showed. But in fact, they misrepresented the data. The actual data showed that the lower your cholesterol, the higher your rates of heart attack and stroke death. So it's completely opposite. You have studies with hundreds of thousands of patients who have had heart attacks in America. 140,000, one had 160,000-ish patients in it. Fully half of them had low cholesterol, low LDL cholesterol. And yet, there's no correlation one way. It was just completely unrelated. But then one of the studies followed them up for 3 years. And obviously their doctors are telling them, lower your cholesterol. Oh my goodness, lower your cholesterol. The ones who did lower their cholesterol and got under that threshold, or the ones who already had low cholesterol, low LDL cholesterol, and maintained low cholesterol, were twice as likely to have died in those 3 years of follow-up than those who maintained higher cholesterol. And the list goes on. I mean, there are studies with millions of patients, one with 11 million patients, showing that higher total LDL cholesterol, and there's also like 100 different kinds of LDL cholesterol, so we really need to talk about which ones if you're really going to talk about LDL. But regardless of the types you have, people that had higher LDL cholesterol in this study lived longer. They had lower all-cause mortality. Okay, so why are we freaking out about this now? LDL is an important molecule in your body, and it is a transport molecule. Cholesterol is a very important molecule. It's the basis for all of your hormones, for your vitamin D. A large portion of your brain is made out of cholesterol. The axons are myelinated with cholesterol, and your bile is made out of cholesterol. Every cell in your body is made out of cholesterol. The membrane is predominantly cholesterol. And what actually is cholesterol, the lipid bilayer is cholesterol. And then you have proteins and different sorts of things stuck in the membrane. So this is one of the most important molecules in your body, and we're fighting desperately to destroy it and get rid of it. And that fits with what you see epidemiologically, because after we started doing that, we started reducing cholesterol, reducing fat, reducing meat, increasing fruits and vegetables, increasing polyunsaturated vegetable oils and taking medications to desperately lower our cholesterol levels. And we have. And what happened? There's 3 times the number of heart attacks. More people are having first-time heart attacks. More people are having strokes. They're surviving it. We have better interventions. We have better hospital systems. We have better access to medicine. We have better ambulance system. That's a major one. You have someone who has a heart attack out in the country, they're dead unless they get into a tertiary center that has a cath lab, right? But now we have ambulance systems, we have helicopters, we have jets that can fly people in to get them where they need to be at huge expense, but it's saving people's lives. And so now you have less people dying from their heart attacks and strokes, but there are more people getting heart attacks and strokes. And that's what's important. And all these other diseases have increased dramatically. Cancer rates have tripled. Obesity rates have gone through the roof. And you're talking about the Polynesian populations there. They're some of the most obese people on earth. America, 70% of people in America are overweight or obese, but 42% are obese. In Polynesia, it can be upwards of 60 or 70% are obese. So, that's massive rates. So these problems have just compounded and gotten worse. Meat was supposed to be the only thing that was bad for us. Cholesterol was supposed to be the only thing that was bad for us. We've reduced it. We've reduced meat. We've reduced saturated fat, and everything has gotten worse. So that's what I tell people, first of all, is that, that the evidence really does not support the idea that meat is harmful at all. And certainly a problem for heart disease. And there's more recent literature coming out now, which is great, from a guy named Dave Feldman and his group with the lean mass hyperresponders. So this would be, our cohort where people are on a ketogenic carnivore diet or a carnivore diet. Ketogenic is the main thing. And they find, wow, look, their cholesterol goes way up. Oh my goodness, that's going to give them a heart attack, because exposure to LDL over time equals atherosclerosis. There's no way around it. And that's completely untrue. That's just a complete misunderstanding of the whole process. This is a biological metabolic state change. When you're eating carbohydrates, your liver does not need to make blood sugar and glycogen. In fact, it's desperately trying to get that blood sugar down. And you suppress ketones. So that is in a state where you're just running on the carbohydrates you're eating. So you don't need to mobilize your fat. In fact, you can't mobilize your fat and run on it. Whereas when you go into a ketogenic state, like a carnivore diet would give you, a ketogenic diet would give you, now your body's running on your fat stores, which is why it helps people lose fat, because they're now actually using the fat that they've stored up over the years. That gets transported to the liver, and that gets turned into blood sugar, glycogen, ketones, and that runs your body. Okay, how does it get to your liver? Well, it has to be transported there because fat and water repel each other, so fat can't travel through the bloodstream. And so it has to be carried and transported there in transport molecules. LDL cholesterol, right? So that's how this is transported. And so when you start running on your fat stores, of course you're going to start increasing the amount of LDL cholesterol that you have, because your body needs more fat to operate. So you have to transport more fat, and that's it. And you can suppress this by eating carbohydrates. You eat carbohydrates for a couple of weeks, LDL comes right down, because now your liver's not making cholesterol. It's very simple. It's very straightforward. And so the lean mass hyperresponder studies with Dave Feldman has shown that they've followed these people up for an average of 4.7 years. They've been on ketogenic diets, high-fat, meat-based ketogenic diets or carnivore diets, and they have very high LDL cholesterol, but they also have high HDL, and they have low triglycerides, and they're metabolically healthy, and everything else says that they're extremely healthy. And yeah, there's just one marker, and most doctors say, shut it down. Go back to having rheumatoid arthritis and gout and cancer and all this stuff, because, oh my God, that LDL, that's going to kill you. All these other things are actually on their way to killing you. So why would that make sense? You're healthier in all these other respects, but as a consequence of that, you're gonna die of a heart attack. It needs to be expanded upon, because that doesn't make sense. It could happen, but that wouldn't be my first guess. My first guess is that maybe we've gotten that wrong. Maybe that understanding of LDL and its relationship with heart disease, maybe that's wrong. Especially because the Inuits, they only eat fat and they start smoking when they're 8 years old. and they have very low rates of heart disease until they start eating Western food. And they have all the genetic predispositions to get heart attacks. People don't understand that. They think they're genetically protected. In fact, they're genetically predisposed to get heart disease, and yet they don't get it. And that was a study shown in 1997. And they compared the Inuit population, the entire Inuit population. So it wasn't just the meat eaters. There was already people living in cities, and they had some degree of heart disease. But even then, as a whole, their overall population had a lower rate of heart disease than Canadians. And they were eating tons of fat, tons of meat, and smoking it from a very early age. They said, okay, well, this must be genetic. They took a look at it and found like, no, they have all the genetic risk factors for heart disease. They had no idea what was going on there. So Dave Feldman showed that these people with lean mass hyperresponders, their LDL was extremely high. And then on average being on ketogenic diet with high LDL cholesterol for 4.7 years, and they had no progression in their atherosclerotic plaque. And in fact, the trend was to reduce atherosclerotic plaque, which I've seen clinically in patients that have had. One gentleman that I was speaking to the other day last year had a 100% occlusion of his right carotid artery. And now it's reduced. He actually has patency of it. It's still quite mired, but there is flow there. Whereas last year there was no flow. So this is a reversal. He's been on a carnivore diet for 1 year, a ketogenic carnivore diet for 1 year. And so Dave Feldman showed like in this cohort, people that are on a ketogenic carnivore diet, that even though they have what some would term markedly elevated LDL cholesterol, this has no relationship with atherosclerosis or the progression of atherosclerosis, because actually, in fact, they showed decrease in atherosclerosis. And so, that is what the data is showing. There are other issues. People say, well, doesn't it cause cancer? No, it absolutely does not. Again, animals eating their natural diet don't get cancer in the wild. And the Inuit cancer rates were extremely low. The WHO suggestion and accusation that processed meats were a carcinogen and that red meat was likely a carcinogen was extremely unfounded. There have been many, many criticisms of this. Even people that were on that panel in the WHO came out publicly and said that this was the most difficult thing that they've ever gone through professionally. And they saw hundreds of high-level, good-quality studies showing no relationship between meat and cancer or any other disease. And they threw those out in favor of very weak, poorly designed junk studies where they included things like pizza and McDonald's in the meat section. So if you went to McDonald's, that's considered meat. That's all meat, 100% meat. The drink is meat, the fries are meat, the bun is meat, everything's meat. No, the meat is the least part of that entire equation. And so they were just completely unscrupulous when they were designing these studies, and those are the only ones that they included, and they still only showed a very weak association between cancer and meat consumption. And so they come out publicly later and said that the people on that, they were vegans, vegetarians, and Seventh-day Adventists, and the Seventh-day Adventist Church are religiously anti-meat. They've been saying since the 1800s that this was a sinful, it causes lustful feelings, and lust is a sin. And so their prophetess, Ellen G. White, said she had a vision from God saying that meat had to stop being eaten because it was evil. And so, they are biased. And so he said, you need to declare your bias. And they refused. But the University of Washington in Seattle published the actual data, looking at all the studies, and looking over 800 different studies 2 years ago, 2022. And they showed that these studies showing a weak link were junk studies. They were garbage science. They were they shouldn't even be considered. And the ones that actually did a proper study design, and give reliable information, all showed that there's no connection between eating meat, even processed meat, and heart and cancer, but certainly not unprocessed red meat. And there was no deleterious effects of eating that. Even the Journal of the American College of Cardiology has come out with a massive paper in 2020 with randomized controlled trials and meta-analyses, reviewing all the literature, and they found no connection between saturated fat intake and heart disease, or cardiovascular disease, I should say. And they found an inverse relationship between saturated fat intake and stroke rates. So the more saturated fat people ate, the less likely they were to get strokes. The less saturated fat they ate, the more likely they were to get a stroke. And so, this goes on. I mean, obviously these are all sort of involved, answers that you get to people, but people have all these questions. They all have answers. Well, aren't you going to lose nutrients? Don't you need things that are in plants? No, you don't. There are nutrients that you have to have in meat that you cannot get from plants or anywhere else, and you need them to survive. There is nothing in plants that you have to have that you cannot get from meat. You can get everything you need from meat. How do I know this? The Inuit exists, and I haven't died in the last 6 years of only eating meat. And our ancestors didn't do it for 2 million years throughout ice ages when there was nothing to eat except meat anyway. And then, think, well, what about fiber? Do you need fiber? No, you don't. The Inuit don't. Lions don't. 70% of animals are carnivores. 70% of animal species are carnivores. None of them eat fiber. None of them need fiber. Why would we need fiber? No animal on Earth eats fibrous plants unless they're able to break down and get nutrition from fiber. We don't. We can't. We lost that ability millions of years ago. So all of these things are legitimate questions. There's something that we've been told and retold for decades now. And so they deserve to be answered. But the thing is that they all have answers. Think about it this way. We've always been eating meat. That's the baseline. We know that's safe. We know we can thrive on that. We know we can become the most dominant species on Earth when only eating meat. So that's established. We know that that's safe. These diseases are new. That's the change. Eating plants is new. That's the change. That only happened about 8,000 to 10,000 years ago for some populations. Other populations have only started eating plants, in the last century. So that's the change. That's the new thing. That's what needs to be proven that that's safe. Because you're saying, no, we can add this in, it's safe. No, you don't have that established. Meat is established. Plants are not established. So they're trying to say that meat is bad. The default is eating their plant products. That's what they're doing. But they've never shown that their plant products are safe. The only argument was, well, at least it's not meat. And it doesn't have, cholesterol and saturated fat. That was the whole argument, was that things that had saturated fat and cholesterol were toxic and harmful and were going to kill you. And so anything that didn't have saturated fat and cholesterol was de facto good for you. That was the entire argument. But, we don't actually have any strong clinical data to show that plants are good for you or better for you than meat. In fact, there's tons of data, like the anthropological data, like the fossil records, showing that when you switch to plants from meat, you cause harm. And now we have reversibility. So we have this cause and effect relationship. You get people off of plants, either from an omnivorous diet or a vegan diet or a vegetarian diet. You put them on only meat and they take away all the plants, and their life improves, their health improves, everything improves. You add back in plants. There are people that have a salad and their rheumatoid arthritis flares up. They take the salad away, the rheumatoid arthritis goes away. That's a reversible cause and effect relationship. And so that there is boundless amounts of evidence showing that plants cause harm, and just eating the wrong things cause harm. The wrong things are anything except fatty meat. That's all there is to it.
You mentioned earlier that study by Dave Feldman and Nick Norwitz, which is, let's say, among the most novel way of looking at the lipids. They call it the lipid energy model. And personally, I really salute those guys for coming up with such a study, and especially Dave. He's not connected with the medical institution, yet he's doing his best as a citizen scientist. And, the guy really deserves a lot of applause for that. And recently, I think he also mentioned that recent collaboration they had with Matthew Boduf of the Lundquist Institute, wherein they studied the baseline for those patients on ketogenic diet in terms of the coronary artery plaque formation, and they compared that with a cohort from the Miami Heart Study, and it was indeed, it's like almost also unbelievable to know that this cohort who have been through ketogenic diet for at least, I think, 2.7 years, if I remember that correctly.
4.7.
4.7. Yeah, for so long. Yeah, and then they have elevated LDL cholesterol, which allegedly is supposed to be a major cardiovascular risk marker. Yet, when they compare the coronary, arteries of those cohorts compared with the Miami Heart, it's like it's the trend is even for those for that cohort having had ketogenic diet for so long to have better coronary arteries than those in the Miami Heart. It's almost unbelievable.
Yeah, well, it's certainly a very good demonstration that this hypothesis, the lipid heart hypothesis, is completely wrong. But I really love that they're doing this. But for me, it's already case closed, because we already know that the lipid heart hypothesis was wrong, because we know that it was made up. We know that the sugar companies pushed that narrative and paid people off to pretend that was the problem. We have randomized controlled trials with thousands of humans, giving them polyunsaturated fatty acids in replacement, replacing out saturated fats in order to reduce saturated fat and reduce LDL cholesterol. And in fact, it did. And more people died of heart attacks and strokes as a result. And they buried it. They buried the study that they got discovered decades later. There were 3 in total. They all got buried. Some of them showed no connection, no changes in heart disease and heart attacks and strokes. One of them showed increased heart attacks and strokes in the intervention group with the polyunsaturated fats and LDL cholesterol lowering. So, we already know that this is garbage. We already know that this is not flawed, but fraudulent. And we have hard evidence of that. We know what they got paid. They were paying these scientists $6,500 back in the 60s, which is the equivalent of $50,000 US now. So you could buy a Toyota Camry for what their soul was worth to them, and what billions of people's lives were worth to them around the world. Because this is let's not mince words. This has killed billions of people. This terribly dangerous misinformation, this intentional distribution of misinformation, of known misinformation, has killed billions of people. They have died young. They have died in illness. They have died in pain. They have been sick for decades until their bodies just gave up and wore out. And that should not have happened. These people should have been much more healthy. They should have lived much longer, much happier lives, not being plagued with health issues, not being plagued with medications and hospital visits and doctor visits, and not being able to enjoy their family and their time with their kids, and they're working their life away, and then they're suffering and they don't have enough energy to enjoy their life, and then they die young before they've done anything. That is absolutely tragic. And I think if you think about these things in that context, that's why I'm so passionate. And if you can't be passionate about that, there's probably not much that you can get passionate about. That really pisses me off when I think about that. And these people piss me off. It's not an extent of, oh, well, we should change this. Those people should be shot in a firing squad, not vigilante stuff. I'm definitely not saying that. But these people should be tried for their crimes, and they should be executed. Like, that's what happens when you kill billions of people, when you knowingly do it. I think the same thing with the tobacco companies. These people for decades knowingly pushed their products when their own studies showed that this was highly addictive, damaging to health, caused emphysema and cancer. And they just lied about it and perjured themselves in front of the United States Congress, saying, oh, no, we have these studies saying everything's good, everything's fine, everything's wonderful. And it's like, oh, well, they have studies that say it's bad, and we have studies that say that it's good. So, we just need more studies, I guess. And what that defaults into is they get to keep selling their poison for decades. And, they made candy cigarettes and all that sort of stuff to try to appeal to kids, to get them, ooh, I want to smoke. I can't wait till I smoke. That's actual product that they put out in order to try to entice children into picking up smoking. It's sick. And so, I mean, these are drug dealers, and like any good drug cartel, you hook your junkie and your mark early. You get them young so that they're addicted for life. That's why you get kids addicted to drugs in school, so that they can just be a junkie the rest of their life and never actually form, a healthy adulthood and attitude towards these sorts of things. And that's what the sugar companies are doing. That's what the tobacco companies did. And, the tobacco companies got fined like something like $400 billion, but they made trillions, and they killed how many hundreds of millions of people? Who knows? I mean, it's just incalculable how many people they've harmed. Secondhand smoke, kids' lungs not developing properly because their parents were smoking in the car and in the house. That's a known consequence of secondhand smoke. And yet they paid some money, like big deal. They knowingly put a product out on the market and kept a product out on the market for decades that they knew would kill people, right? So you go off and you poison a well and you know that that's going to kill people. You get tried for murder and you hang. That's what happens. These are the same thing. These are well poisoners. They know that this is causing harm. They know this is going to kill people, and they just don't give a shit. And so they're putting this out there, and they're pretending their product's safe so that they can profit off of people dying. I'm sorry, your life is forfeit at that point under the rules of any reasonable civilization. And so I think that those people should absolutely have been tried criminally for this. I think that the sugar companies should have been tried criminally for this. The thing is, we're 60 years, detached from where that started, and the original people that signed those original contracts. But those companies and people that are in charge know that happened because it's their company, and they know that they're pushing this stuff out, and that this is causing harm, is causing diabetes, is causing mental, metabolic issues and other sorts of things. And they're happy about it because then they sell pharmaceuticals that then, treat these things, and they make even more money. And there's whistleblowers such as, Callie Means, who has come out and said, the food companies know that their food causes harm. They know that it causes disease, and they're happy about it because they're invested in the pharmaceutical companies that profit off of that disease. And I know that they know this because I've been in the boardroom meetings with them when they spoke about it, right? So that's his words, not mine. He was in the boardroom meetings with them talking about this. So that's malice aforethought. That means that you are knowingly causing harm. You're knowingly do something that will cause harm, and you do it anyway. That's criminal at that point. And this is costing people's lives. This is costing billions of people's lives. And I think that under no uncertain circumstances, these people should be tried criminally for these actions, and that this should absolutely be stopped immediately. And then, at the very, very least.
That truly be crimes against humanity.
Absolutely. Yeah.
Yeah.
Well, you have Coca-Cola trucks driving into the Maasai villages in Africa. These people have been extremely healthy, just eating, traditional meat and milk and blood diet. And then in the early 1920s, they had vanishingly low levels of any sort of illness and disease. And they'd already started eating, grains at that time, but not as much. And then throughout the 20th century, they started getting more sick. So again, we're seeing this in real time. In the 1970s, you start seeing heart disease start to climb in the Maasai. There was no mention of heart disease in the studies in the 1920s, going into the 1930s. They're very in-depth. No mention of heart disease. And then 30, 35 years later, all of a sudden they have heart disease. Well, they're eating more and more grains and plants and sugar, right? Now you have Coca-Cola trucks driving into these villages, and they're sold out within minutes, and they come in every day, every single day. And that's sick. That's truly sick. And now they are plagued with, tooth decay, malformation, misdevelopment. They're not growing up as tall and strong and sleek and powerful as they used to. And they are struggling with diabetes now. And they have no idea that sugary drinks can cause diabetes. And so, Dr. Mark Hyman from Cleveland Clinic, he actually went to visit the Maasai, and he was there, and he was seeing this firsthand. He was horrified by it, and he spoke to their, the village elder at the location he was at, and he said, "Hey, this stuff can really cause diabetes and obesity and cause all these problems." And he was horrified. He said, "Oh my God, I didn't know that. We actually have a big problem with diabetes. We didn't know. You think this might be, contributing?" He's like, "Yes, I do." And so these people are being seriously taken advantage of. There's, "Oh, hey, look, isn't this nice?" The ads in the 80s and 90s, going into Africa and giving little kids bottles of Coke, and they're like, "Oh, this is great." I mean, you're destroying these people's lives. These are just drug dealers. This is the modern opium
cartel.
Industry. Yeah, well, it is. It absolutely is a cartel. It just happens to be legal, right? But it is absolutely a cartel. It's the same mindset. It's the same operation. It's the same products. And so the opium trade, that's what I was trying to think of. So, people made entire kingdoms and fortunes and empires based on the opium trade of buying and selling and moving and importing opium and just destroying people's lives. And now we're in the next run of that is just sugar. And I think, sugar absolutely is the next opium trade. And it has even more devastating effects than opium, because at least people could see, the acute harms, of opium. Sugar, damage from sugar takes years before that starts coming on. So people don't make the connection. And you give it to kids. I mean, who the hell was giving opium to kids? It's just like, it's just absolutely crazy.
Well, time to change all that and re-educate everyone worldwide, I suppose.
Definitely.
So I have a collaborator locally here in the Philippines. As far as I know, she's the only dietitian that is really advocating for the carnivore diet. And you know how dietitians worldwide go these days. Even until today, when dietetics was first established by Lena Cooper, suppose you've heard of Lena Cooper. So this colleague of mine, I collaborate with her. Here she happens to be listening in. So I think I have a few minutes to pitch in her questions before we wrap things up. So have you heard of Mindy Pelz?
Which one's that?
Mindy Pelz. She's asking this question about
Pelz. Yeah, I do know of her. I haven't spoken to her yet, though. Yeah.
Yeah. So she has this question: Do you agree with the recommendation of Dr. Mindy Pelz for women with regards to hormones? She asked that Dr. Pelz recommends that the fasting that is for women be cyclical, not 1 meal a day or 2 meals a day always, and that it should be timed with the hormones. And together with this, it should also be together with cyclical ketogenic diet. Like there are days that one needs to eat more carbs, and there are days that they need to do low carbs. What's your take on this? Should women? Is this also applicable to carnivore dieters who are women? What's your
Yeah, I mean, I don't know all of Mindy Pelz's arguments for that, or what she's sort of coming from on that, but I have heard that. The way I sort of think about it, though, is sort of answer a question with a question. What other animal species does that? What other animal species has a disparity of what they eat between male and female? When lions are in estrus, do they go around eating tubers? And what tells them to do that? Because it would have to be something automatic. It would have to be something that ingrained that their body is telling them. The lion doesn't know what chocolate is, and so it just says, it's just like, oh my God, I'm pregnant, I need chocolate. That they don't do that. They eat meat. Lions eat meat. Pregnant lions eat meat. Non-pregnant lions eat meat. Pregnant lions in estrus eat meat. Lions that aren't in estrus eat meat. Dolphins eat what dolphins eat. Elephants eat what elephants eat. Giraffes eat what giraffes eat. They all eat the same thing. Now, a cow can eat all the grass it wants. It will never, ever be on anything except a ketogenic diet, because it breaks down the fiber into fat and protein. It does not absorb carbohydrates. And so, they will never be able to cycle their carbohydrates or come in and out of ketosis and all that sort of stuff. So I don't see how it makes any, sort of evolutionary sense. I don't see how we could have done that during the ice ages, the Inuits, things like that. What carbohydrates do they have? And what innate signal would be telling them that they need to go eat something apart from their native diet? So I don't really see that you have to do that. Maybe she's arguing that, there's some sort of mechanistic pathway where it maybe helps and supports hormonal health. I'm sure that's probably what she's saying, but we can get caught up in mechanistic sort of data, and I think it's important, but I think it's, but you can get sort of caught up in that and say, well, this should technically affect these hormones in this way. But is that a better outcome? Does that increase fertility rates? Does that improve health outcomes? I don't know if it would. But what I do know is that we have not done that traditionally in the wild, because how could we? What would tell us that we can eat this stuff? When we're in the ice ages, when the Inuits are just out there eating meat and fish and fat, they don't have carbohydrates to eat. They're going to cycle every single month. So it's not like women in the Inuit populations are just gathering up a bunch of honey and then, during the winter months when they don't have anything available, they're just like, okay, for these 2 weeks, I need to eat this honey. And that doesn't make sense to me. And no other species of animal does that. You don't need to micromanage your hormonal levels. You don't need to micromanage your hormonal cycles and your health cycles and your physiology cycles. If you just eat what you're designed to eat, your body will work the way it's supposed to work. And so I don't think that that's necessary. I don't think that that's optimal. I don't think that that's something we need to do, because that you don't see that anywhere else in the wilds of the planet, including in human populations. So, humans eat what humans eat, lions eat what lions eat. And if you eat what you're designed to eat, you're going to be healthy. So I don't think you necessarily need to do that. Interestingly enough, about Lena Cooper, you mentioned her. She was one of the founders of the American Nutritional and Dietetics Associations. She was also a Seventh-day Adventist church member. So the basis and foundation of the nutritional and dietetics, field was founded by the Seventh-day church member, and it was from day one. It was plant-based ideology, and they wrote the first textbook taught in university nutrition courses in 1925. And that's still, current edition is still being taught today. And it was all plant-based. Oh, got to get rid of meat. Meat's so bad. But that's that ideology again, coming in from a religious background.
This colleague of mine, her name is Janet Almacin. She's the dietitian I was referring to earlier. She has another question here. I think I can still ask this with you. What is your position with regards to sugar substitutes, like for example, stevia, monk fruit sweeteners? In your from your end as a carnivore diet advocate, what's your take with regards to that?
I think it all comes down, to first principles. What are we designed to eat? What have we been eating for millions of years, hundreds of thousands of years, at least tens of thousands of years? I have my litmus test is if it or some iteration of it didn't exist 50,000 years ago during the last ice age, I don't want to eat it. And so, that would go for artificial sweeteners. So it may well be that that there's no harm in these sorts of things, but they didn't exist 50,000 years ago. They are chemical. They have chemical reactions in our body. And so, it's definitely not something that you need. And it may not be something that you want. Now, I do go further than that with these, because I do think they cause harm. And I think there's ample evidence for that as well. Some people say, well, they don't have calories, so they don't raise insulin, and they don't disrupt blood sugar. And my answer to that is, so what? They are chemicals that go in your body and have chemical reactions. We are not combustion engines. We are not burning our food to release heat energy, which is what calories are. Calories are not a great metric for measuring, certainly not weight, but definitely not energy. because a lot of amino acids and fatty acids don't even get used for energy. They get used as building blocks and materials. And so, that's sort of meaningless to sort of try to count how much energy is released when they burn it. So looking at it from non-sugar sweeteners, say, oh, when you burn these things, they don't release any energy. It's like, okay, and what's your point? That doesn't mean they're not chemicals. They don't have chemical reactions in your body. Stevia, for example, in animal studies in mice, given one, soft drink flavored with, sweetened with stevia equivalent, tiny, to a mouse or rats, or whatever they used, showed that reduced their fertility rates by 55%. So just one diet soda equivalent in mice reduced their fertility by 55%. No calories. Who cares? It did something to their body. Erythritol. This stuff is not great. First of all, it acts as a laxative. People get diarrhea from this stuff. That's not fun. And, that can cause malabsorption. That can cause other sorts of issues. You're absorbing this into your body. What does it do? It's not, well, it tastes sweet and it's free. No, it's not. There's something happening to your body when you put this stuff in. So I don't like them. I have certainly seen people stall in their weight loss when they use artificial sweeteners. I've seen people gain weight that they've previously lost by using artificial sweeteners. And I've seen anecdotally people have issues with their fertility in general, even on a ketogenic diet, but they're using lots and lots of stevia because that's ketogenic supposedly. And so that's fair and that's legal. And they're having very difficult times to conceive. They get rid of the stevia, they clean up other things as well. So, there's other things involved, but then all of a sudden they're able to conceive. So this can make a big difference, and it could potentially make a huge difference. There are a lot of people that have done quite a lot of research into this, and they're really anti non-sugar sweeteners. I just think of it as like, this is a chemical, and this is not a chemical that you need in your body. It's not a chemical that therefore it's not a chemical you want in your body. You should not put anything in your body that is not designed to be there. And these artificial sweeteners are certainly not designed to be there. People say, oh, here's this new one. It's a new one. It's better. New is worse. I want old. I want what we've always been doing. I want something that's 50,000 years, 100,000 years, 20 million years old, that we've always had exposure to, and we know does not cause harm.
So when you're talking about stevia, perhaps that may still be related to plants trying to kill you. Stevia is plant-based.
Yeah, absolutely. Yeah. Well, that's it. These are having some weird interactions in our body. We get this somewhat sweet but weird chemically taste. And so we think, oh, great, sweet. Well, okay. How much do you really care about sweet? Is it you care more than your health? I don't. Some people do, I'm sure. But that could very well be. There are hormone disruptors that are throughout the plant kingdom, and it seems that stevia could be one of them, or do other sorts of unhelpful things as well.
Thank you for all those insights you have, Anthony. Really, really very much appreciated from your end. For everyone interested to know more and understand the carnivore lifestyle, what particular resources, perhaps online tools, would you be able to recommend for them to follow, or perhaps for the public in general to learn from?
Mm-hmm. Well, I try to make everything available on my YouTube channel. It's just Anthony Chaffee MD. My Instagram is Anthony Chaffee MD as well, and I try to post a lot of these things. Twitter is a good way to do it, and you follow people. You follow people like myself, or Dr. Ken Berry, Dr. Sean Baker, Dr. Nick Norwitz, Dave Feldman, and so many others. I'm Dr. Robert Kilt, Laszlo Borosh, and Gabor Somlai. All these people are doing amazing research and amazing work, and putting out novel research on top of all of this. And so you can look at their materials as well. But if you want to read books on this, people have done so. Like Dr. Sean Baker wrote a book called The Carnivore Diet, who discusses a lot of these things. I'm writing a book talking about trying to make the argument that the chronic diseases that we're treating nowadays as a mainstay of modern medicine are really not diseases per se, but there are a combination of toxicities and malnutrition. So, toxic buildup of a species inappropriate diet, and a lack of species-specific nutrition, namely too many plants we're not designed to eat, not enough meat that we are. And but you can go back, you can read those books like I mentioned from Wilhelm Stefansson, The Fat of the Land. You can go back to the 1800s to Dr. J.H. Salisbury, who wrote a book called The Relation of Alimentation and Disease, basically exactly what I'm writing, the relationship between the food you eat and the diseases we get. And he showed that you could reverse these things like rheumatoid arthritis, Crohn's, gout, ulcerative colitis, chronic Lyme disease, chronic fatigue, even tuberculosis could fix these things by putting people on a pure red meat and water diet. And that was in the 1800s. And so you can read his work. He did a 30-year research project into the optimal nutrition for humans, and this is what he found. You can read The Stone Age Diet by Dr. Walter Vogelin in 1975, where he said, humans are carnivores. Here's the evidence for this. And all these diseases that I treat as a gastroenterologist, they don't exist if you don't eat plants. That's the gist of it. And so many more. There's a lot of these other books. I mean, oh God, how could I forget? Weston A. Price, he is a dentist in the early 1900s. He went around to indigenous populations, found that they were extremely healthy, big jaws, well-developed teeth and facial structures. They all got their wisdom teeth. They didn't have dentists. They didn't have dental floss. They didn't have toothbrushes, and yet they had amazing dentition. And then they saw people, when they started changing the way they ate, successive generations got smaller jaws, more crooked teeth, and more health problems and facial developmental issues as well. And then there was reversibility. The next generation started eating more and more meat and getting better at nutrition. They reversed that back out. So, his work and all the rest of the work, I think those are the foundations of this, of understanding to all this. And, a lot of us do try to compile a lot of that information and make it more digestible and, podcast form and video form, and having discussions like these with people like yourself and other experts who have done a lot of research into other areas. And maybe they're not all carnivores, maybe they're not even all keto, but they have something contributory, like Dr. Robert Lustig. I don't think he subscribes to a ketogenic, certainly not a carnivore diet, but he knows about how toxic fructose is and how harmful this is to the body. And that's an important addition to this argument. And again, it's something that we're not designed to eat, that we're not supposed to have, and it's going to cause harm. So the central premise is the same, and this is contributory to that. And so I think just asking questions, having an open mind, looking at both sides of the discussion, saying, okay, well, there's all these people that say cholesterol is bad. Well, let's see why they're saying that. And there's a lot of very reputable doctors that think that. Most do. But that's changing. And why is it changing? Because the evidence is strong. It's strong enough to change opinions. And so you should look at both. And you should see, okay, which one holds water? And, and I try to put links for studies and things like that in especially the ones that I'm talking about cholesterol specifically. I put a lot of links for cholesterol studies, and especially the ones I talk about. And you can check those, and you can see if you agree, and you can see what they say. And like, well, maybe I misinterpreted them. Stranger things have happened. But you take a look at that. You see what I'm saying. You look at my arguments. You look at what I'm basing that on, and then you make your own decision. And the more and more people that do that are trying carnivore. And then that's the most important thing, because it doesn't matter what anybody says. It doesn't matter what any study says. What matters is what happens in your real life. If someone is saying that if you eat this way, you'll get diabetes and cancer. If you eat this way, you'll get better. And the other one says the opposite of that. And you try something and your diabetes gets better and your health improves and your weight improves and all these other things improve. Well, it doesn't matter what any of those studies said, because that was the effect that you had in your life. And as the physicist Richard Feynman said, it doesn't matter how brilliant your theory is, and it doesn't matter how smart you are. If it doesn't agree with experiment, it's wrong. As the only experiment that matters is the N of one, your experiment on yourself. And so if you do something and it helps you and it benefits you and it makes your life better, then that's a good thing. And if it makes it worse, then it's a bad thing. It doesn't matter what any study or any person says outside of that.
And Janet's been asking here about your book. You mentioned that you're writing a book. When is it coming out?
Hopefully this year. I keep saying that, but with things being just so busy, I'm just trying to get it out. I'm sort of halfway through it now. Once I get it all sort of together as a first draft sort of thing, I'm gonna probably take some a couple weeks off and just go through it and reread it and redraft it and rework it and try to get it exactly the way I want. And then I'll look into publishing after that.
Good luck to that, and hopefully you do get to come up with that this year. And Janet here says, thank you, Dr. Anthony. And she says, best regards to El Marie.
Yeah.
She's an avid follower of yours, I suppose.
Oh, well, thank you very much. Yeah, I will definitely say hi.
Yeah. So any parting message you might want to leave, especially to those who might want to adopt the low carbohydrate, specifically the carnivore lifestyle, and yet are still in limbo about it as of the moment. And let me ask this ahead, corollary to that, also to our fellow doctors and medical professionals worldwide out there still have doubts about eating meat. What words can you say?
Yeah. Well, the thing is that, in addition to all the other sort of books and resources that people can look at, there are medical conferences that talk about this. There are medical conferences in the US and in Australia and New Zealand and in Europe and all over around the world. I'm sure they have them, in the Philippines as well, where people are talking about this research. It's niche. So, it's not necessarily going to be spoken about at every single conference, but there are large conferences around the world that give CME credit in order for doctors to go there and learn and continue their own education. And they can speak with some of the most, prolific and respected doctors and researchers around the world at these conferences. They're amazing people at these. I've met absolutely fantastic people and researchers at them. So there are quite a lot. There's a lot more information, a lot more studies than people realize. And when you start digging into the research, then you start watching some of these presentations, you start looking at their sources, and you start realizing like, wow, this is very different than I was taught in medical school and residency. And so, it behooves us as doctors to question things. There was the famous Harvard graduation address for Harvard medical students in the 1930s that said that basically the address was to the students, and the professor saying this said, 50% of what you've learned here at Harvard is going to turn out to be wrong, but no one's going to tell you which half. And so it's up to you to figure out what's right and what's wrong, and what was based on good information, what was based on bad information, through your own experimentation, through your own research, and continuing on with your education. So this doesn't end here. Half of what you learned is wrong. Now you need to go figure out what that is. And so we need to understand that as well. Half of what we learned is wrong. Probably more than half of what we learned was wrong. I was told the same thing in my first year of medical school. I don't know if anybody else in my class listened to this, but it certainly resonated with me. And he said that in our first year of 4 years, he said, by the time you graduate medical school, everything you will have learned in medical school will be obsolete. You have to stay current. You have to stay on top of these things. Some of these things are just going to be completely wrong. And you have to keep on top of that, because no one's going to tell you what that is. You have to do it. And so that it's up to us. It's up to us as doctors and clinicians, and certainly as patients, because most of these things are wrong. Doctors are just doing the best that they can too. Some of them are being influenced by, people that don't have our best intentions at heart. But most doctors do have their patients' best intentions at heart, but we're being led down the wrong path. And as such, patients have to educate themselves. The only people that say, don't do your own research, don't educate yourselves, oh my God, why don't you just listen to us? Those are people trying to control you. It's the age-old saying, you keep people ignorant, you keep them under control. And anyone who tells you not to educate yourself is trying to keep you under control. Never listen to anybody who's telling you not to educate yourself. That's ridiculous. So educate yourself. Learn this for yourself. Go to these conferences, read these books, read these papers, look at the competing arguments and see what you think holds water, because at the end of the day, it's your life. It's a really bad idea to put decision-making in the hands of people that pay no price for being wrong. So you can have all these people sitting in their ivory towers saying, all you little peasants should do this. But it's the peasants doing it. And they're real people. We're the peasants, right? And so if you do something and you take their advice and it's wrong, only you suffer. They don't suffer. They may not even care. They may even, oh gosh, I feel bad about that. Most of them don't care. Professor Tim Noakes cares. And how do I know this? Because for 30 years, he's one of the top sports medicine doctors in the world. And he wrote tons of books about how you need carbohydrates to be a top athlete. And then, 10, 15 years ago, he realized, oh my God, I was wrong. And I've been hurting people for 30 years. He could have retired with a sterling career and just, his books were selling, would have been fine, right? But he didn't. He said he came out of retirement to undo his own legacy, right? So that's integrity, and that's someone who actually cares. So other people would just be like, it didn't work. Okay, oh well. Those are real people's lives that affects. And so at the end of the day, the only person that can be responsible for your own life and health is you, and that's why you need to be educated, and that's why you need to be able to try to look at data and try to look at arguments and say, okay, what am I going to do? Because the buck stops with you. If you do something and it damages your health, it's your health, right? So you need to try to make the decision to improve your health. And that's why you need to educate yourself as well. So that's what I would say. Just do the best you can and think for yourself, and don't let these people run over you with their agendas.
I think the magic word there is self-learning. Most of these things that we have discussed here cannot be encountered in industry-sponsored conferences, especially for us medical professionals and doctors, because most of us probably would just be hearing about how this drug is meant to treat this disease, but then going back to the root cause, that would be hard to really encounter in major mainstream conferences. So there, as you said, there are niche metabolic health conferences out there that doctors can probably join. They can learn a whole ton of medical information that is not mainstream, but is the real thing out there. So they should pay attention to that. And also self-learning, as you said. And as you if I may reiterate what you said, our health, I tell this to my patients, your health is your personal responsibility, not mine, because I may be wrong. Most doctors may be wrong at giving you their advice. But then if you do your best to self-learn and to really continually do your own research about which stuff is good for you and which stuff is not, then bottom line is it's your own health that you're taking care of. I'm sure you agree with that.
Definitely.
So to everyone listening in, feel free to share your thoughts, or if you have questions about metabolic health, and specifically probably in relation to the carnivore diet, note them down in the comments below. So thank you very much, Anthony, for this valuable time you've shared with us all. And I'm sure everyone would have learned much from all the insights that you have shared in this podcast.
Not a problem. Thank you very much for having me. It's been a pleasure.
Yeah, and I salute you for everything you've done for the carnivore diet lifestyle through the years. And it's really, I think you've really successfully reached a whole lot of audience worldwide, and they surely have learned a lot from you. And I salute you for that.
Well, thank you very much. I appreciate that. And thank you for your work as well. And bucking your, I mean, it's sort of easier for me because I haven't been in the system for so long. You've had to buck your whole training and everything you've done and really rearrange your entire practice in the last couple of years. And so that takes a lot of guts, and it takes a lot of integrity. So I appreciate you as well.
Yeah, I can only remember what Gary Fetke, he's also there in Australia. I had a chat with him a couple of months ago. That thing he mentioned to me really still rings a lot in my ears. He said that you cannot unsee what you have seen, and then I'm just doing the right thing. When I was asking him about why he had to go through all that travel that he had with the HPRA there. So again, thank you very much, Anthony, and I really appreciate all the time you shared with us here. Thank you.
You're very welcome. Thank you.